Let's take you back to our top story. The Health Minister Zweli Mkhize saying that he does not consider the controversial scooters purchased by the Eastern Cape Health Department to transport patients a failure. Mkhize says the scooters were just additional support to carry patients from small roads to ambulances. Let's talk more about this then. I'm joined by Dr. Thobile Mbengashe. He's with the Eastern Cape Health Department. Doctor, very good afternoon to you. Thank you so much for joining us. So 100 scooters is what you were supposed to have procured. Are they now all in your custody and being used?
No, they are not yet in our custody. We did award the contract to a local supplier, but we're just following now the due diligence of really making sure that we're negotiating the best price.
What is best price? Because what's been spoken about is a figure of 10 million rand. Is that what you're going to pay?
Well, each scooter costs about 100. Each scooter costs about 100,000 rands. But what we really wanted to know was that the scooters are imported. So we wanted to know the import cost. We want to know the taxes. We want to know the modification, and then negotiate a price. I think it's a usual practice around the procurement processes. So there's nothing untoward about that. So once we've done that, we'll then issue the purchase order. We have not issued the purchase order yet.
Let's speak about that. To your mind, the Eastern Cape, of course, is not a wealthy province. That's been worsened now by the impact of this COVID-19 pandemic. We know that the scooters themselves have not been procured at this stage to deal with COVID-19 cases specifically. Do you think that 10 million rand is a fair price to be paying, given everything else that's going on with finances in government and, of course, the emergency allocations that are now needed?
Yes, I think if you consider that a scooter, 200cc scooter with modification plus a contract for 3 years to actually maintain them, I think it's a fair price, but I think we always are very prudent because we don't have a lot of money. What's important that these scooters will actually come very handy because we're going to use them to deliver medicines because we want to protect the elderly from coming to our hospitals. Our situation in the Eastern Cape, especially in the rural cases, you can't bring this care in other places. Therefore, you have to use some of this innovation. But the second one, we think really is going to help community health workers as they go up house to house to try and assist us with the COVID and other primary health care responsibilities.
Let's get to the main issue then, why these scooters are now in the limelight. The Health Minister Zweli Mkhize responding to a parliamentary question from the DA saying that the scooters are simply not equipped or not suitable to ferry patients at this moment, but that was never said outright. Why was that never clarified from the very beginning?
I think the Minister is quite correct because the National Health Act really specifies exactly what constitutes a patient carrying a vehicle. These scooters are not ambulances and they are not registered for that and they will not be used as ambulances. I think what really caused the confusion was that the idea of innovation of using scooters in trying to respond to very rural areas was a very exciting one. I think at the time when these were demonstrating, they were demonstrated as capabilities of these scooters and things that needs to be done. I think that part, which is really was an exciting component, was read as if we have actually now committed to the scooters that have these sidecars. I think what we have really committed on is to have the scooters that are able to deliver medicines to communities and are able to be used by community health workers who will be trained to use them to go house to house and actually providing the services to communities in very deep rural areas.
But Dr. Mbengashe, I mean, at the unveiling, if we can call it that, of this fleet of scooters, or at least when they were shown off the first time, the MEC of Health was among the people who basically suggested that these were ambulances of some sort. Was she not clear about the purpose?
The MEC really, what she was saying is that, we've had instances where communities had difficulties in reaching the clinic, and therefore they had to be ferried by wheelbarrows. I think what really the MEC was saying that, look, he was saying, if these scooters can be registered to actually ferry the person from home to the nearest clinic in order to provide that. But that was really a demonstration of the capability of the scooter, but that was not a buy decision or a buy commitment in terms of the other part. But really, the MEC had also seen these scooters being used in some of the other African countries with great success. And I think that's what she was really communicating at that day. So we have not intended to use the scooter for ambulances. They will not be used for ambulances, and will not be buying scooters at this stage with a sidecar or carrying people. So we're just going to focus on the scooters that are able to transport community health workers, that are able to transport medicines and actually able to reach communities in the most difficult and rural areas. That's what we're going to do. So when we issue the purchase order of the 100 scooters, none of them will have carrying capacities or sidecar or an ambulance-like a structure.
I suppose the question, Dr. Mbengashe, is about why so much would be made of a capability that these scooters have if it was never going to be used, if it was never the plan. Why was so much made about the fact that they could possibly carry a patient?
I think you're making a very important point. I think what's really important is that there is a need for us to be thinking outside the box. There is a need for us to be much more innovation. There is a need for us to really reflect about if you really have to deal with difficult terrain and difficulties of moving people in a very, I think that's what really was actually demonstrated by the owners of the scooters of what is actually possible. Because the scooter that we had, these were not our scooters. This was just a demonstration of capabilities of these with modification. So the different modifications are very different elements that can be added onto the scooter to achieve different objectives. We know now in the country there are very strict rules and laws and regulations around ambulances, and we can't use the scooters as ambulances, as the minister has actually indicated, and there's no intent then to actually get scooters that are used as ambulances.
At this stage, is it your word that at no point ever will these 100 scooters ever be in a situation where a patient is put on board and then transferred for a long distance, for example?
Yes. I think what is really important is that we have to be compliant with the regulations. We can't use the vehicles unless they've been satisfied for that particular purpose. As to the point in time now, none of these scooters in their modification in terms of the countries have been really registered to carry patients. So that is really an important part. Whether the innovations will go to that levels in the future, it's something different. But what we will not buy scooters that are carrying patients, and that is contradictory to the National Health Act in terms of the regulations.
Do you accept responsibility for the subsequent confusion?
Well, I suspect maybe, from where I'm sitting, I think people read the availability of the scooter in front and the attachment of the transport system as something that probably we have actually done. And maybe I accept that we might not have been clear enough to say this is not, it's just to show the capabilities of the scooter, but that's not what we're buying. And I think quite clearly the minister has been very clear to us that there was no time that the minister was informed or believed that we're buying the scooters for transportation of the patient. But the idea and the innovation of really finding something that could really make and relieve the people who have difficulties in walking to the clinic and being brought by a visible, usable, registered entities, that was really the innovation that was exciting.
But here's the issue with the Eastern Cape. If it's not the issue with the scooters, it's patients seen sitting on floors in hospitals, expectant mothers being made to wait long hours in unsanitary conditions. It is protests by staff at hospitals, and the list goes on. What exactly is going on in the Eastern Cape Health Department, and do you as the leadership believe you can be trusted to fix all of it, especially at a time when the country is dealing with a pandemic and many South Africans are anxious about where this is going, without the additional worry that is now being brought on by issues where government is unclear about the use of something like scooters? There are now worries about the integrity of the contract itself, etc.
I think you can mix these two. I think the key issue is that Eastern Cape is faced with a huge surge like all other provinces. And I think what is really clear that the fault lines of poor investment in infrastructure and some of the difficulties and constraints in healthcare services, those get exaggerated. I think what we have really experienced as a province is really the anxieties and the fears amongst our healthcare staff, and that has also created, one of the challenges that we have. I think in terms of really preparation, in terms of what we've done in using the lockdown, we have actually 8,000, field hospitals that are going to be available, and we repurpose around 2,000 hospitals. We're building up 300 ICU beds, and we really are appointing over 3,000 people to really respond. I think what we're saying is that the COVID period is going to be something that we're really going to use in order to cover and respond to some of the areas that we have. There's been a major change in the way how we're doing business, and we're creating the agility to respond to most of the problems. I think for me, where I sit is that many of these crises are really pushing us to do more than we would have done if there was no crisis.
Very quickly, Dr. Mbengashe, please, but do you accept this afternoon that the continuous errors in the Eastern Cape Health Department, including this one, further dent people's confidence in your ability to lead the province through this crisis?
I think there was no error in this one. I think I've explained what has actually happened. I've explained some of the confusion where it's coming in. I think the province really, if you look in terms of our programs and the things that we're actually doing, I think we're all faced with a big surge and the difficulties of the situation of magnitude that was never experienced before. I think we really have a very strong leadership in terms of what we can do and actually achieve. And Eastern Cape, in terms of its ruralities, the high densities of communities, the mobilities, and the rural nature of our services, and the burden of disease that exists, all these things are confluenting and getting back joining together. But I think we have a plan. We're working on to this. The president was here. He saw our plan. The minister was here. He felt the plan were in the right track. We need to move faster, and we're building up on all those things to make sure that we have a good response when the COVID is actually going to be hitting us at a higher level in August and September. So we are really getting ourselves for that. And again, we're not unique in that situation. Cape Town, Western Cape, and even other provinces have been faced with a similar problem.
Okay, Dr. Thobile Mbengashe with the Eastern Cape Health Department. Good to speak to you, sir.